it's really important to get all the great minds and health leadership into the one room at the one time, simply because we have an unprecedented opportunity to drive primary healthcare change.
The way forward has been mapped out. The question is there the political will to take it forward? Our job tomorrow is to map out the way in which that might be done.
So Leanne and I started with the idea that we might get 50, 60, 70 people in a room and talk about reform, and we might get half of the PHNs here, but we got every single PHN, we got many of the peak bodies talking very similar language about what's important to them.
We're all working away providing our primary care coordination contribution at our local level, but in order to have the best primary care system that our communities deserve, we have to talk about primary care reform.
Over the years, there's been numerous reports, inquiries, summits similar to this, but I'm getting the sense now, particularly after I think the galvanising impact of COVID, that we're now at that cusp of being able to think about doing things differently, and I think there certainly is that collective will to now get on with it.
I've been in the game now for 25 or so years, and there is a hugely strong consensus at the moment, and probably stronger than I've ever seen it before.
The 2031 is when we've said we're going to close the gap in Indigenous health outcomes in this country. Therefore, we need to move with pace, action, rather than more inquiries, more task force, all that stuff. It's a recipe for time wasting, and I don't think we've got time.
We've had 2 years developing a 10-year primary healthcare plan, deep, extensive consultation. The roadmap's there.
This is different, and I called it an inflection point. This inflection point is us all saying the same thing, us communicating in the language of the incoming government, and us doing it together.